The tremor mechanism is the easiest way to say it. It's an innate inheritance in the human body, meaning we are born with it. It works with our cycles of stress and relaxation. It works with us when we have illness and we're trying to recover. So it's actually just organically moving us, constantly trying to restore us back to health as much as that is possible. And it does that no matter what we end up doing to the body or no matter what happens to the body. It's always there. And so we need to activate it, and sometimes every day, sometimes every other day, once a week, sometimes after a certain protocol. If you're going in for chemotherapy, when you come back, you may be sick for like 2 or 3 days. You may be nauseated. If you're laying in bed, you could activate that tremor mechanism very gently, almost to try to just gently nurture yourself back out of the difficulty your body's experiencing from something as intense as chemotherapy. So you have to learn, practice how to actually utilize it, just as you're just taking your medications, or you're trying to get up and you walk around the room slowly, maybe just for 1 minute, but then you have to lay back down. You could tremor for 30 seconds as well, and you might discover that's enough, or it might be refreshing, and you discover it's helping you to move through the difficulty that your body is having. So think of including it in every way, all of the other interventions you're making in your body to help sustain it in a healthy state.
Okay. So just like you're talking about too, like doing it gradually, like if there has been that surgery or that chemotherapy, right? So getting ourselves to think that it doesn't have to be for like a 5-minute or a 10-minute. It literally can be these small little increments. And sometimes if we do them consistently over time, that's where we see big results. And
that's
so that's
exactly right. Yeah.
That's what it sounds like you're saying.
Yes, you could tremor for 30 seconds and do it 3 times a day. Then the body starts getting used to it, because what you've done is you've shown the body, I'm available to let you activate when I need you. And the body responds to that. And so then it could tremor for a minute and it feels pleasurable. See, so now you've, in a sense, appropriated the tremor mechanism in the way that you can receive it right now. And then the tremor mechanism starts working with you. And now there's a dialogue within the body itself.
Okay. So it's basically going to be working with you and for you.
Yeah.
Okay.
Always. Usually the hesitation is our fear around it. But if you introduce, like I said, even just small moments of that, the ego generally calms down, because the tremor mechanism is actually producing pleasure in the body. Well, once the ego feels safe and there's pleasure being increased, then the ego lets go and says, oh, this is good. Because we've been trained not to let go of our bodies. We've been trained to control them our whole lives long. The other thing the tremor mechanism does is it increases the immune system. So once you decrease stress, the immune system automatically increases. And so we have to keep de-stressing ourselves, and that keeps improving the status of the immune system.
Right. So that is huge, right? Whether we are working on prevention, like we were talking about, or healing, or trying to prevent a recurrence if we have a diagnosis, this is exactly the things that we talk about, trying to get rid of the things that can be contributory to a disease process, as well as what can contribute to health and wellness, so basically this is helping return the body to a point of homeostasis where things are starting to go into balance from being out of balance at some point.
Perfect summary. That's exactly right. Restoring homeostasis.